Welcome to Front Seat to Climate Change. I'm your host, Mahin Azam Khan. This year, heavy monsoons and glacial lake outbursts have killed more than 700 people across Khyber Pakhtunkhwa and Gilgit-Baltistan, displacing thousands. In makeshift camps with food and clean water already scarce, women are left without sanitary products, privacy, or safe spaces. Menstrual health, a basic human need, has become one of the least visible yet most urgent challenges of this disaster. To help us understand how this crisis deepens during disasters, we have two guests with us today. Ayesha Amin from Baithak and Bushra Mahnoor from Mahwari Justice. But first, let's talk about the barriers. In flood settings, broken supply chains means menstrual products vanish from the market. Women and girls, most of them putting family needs before their own, are left to improvise with unsafe materials, risking infections and long-term health problems. In Pakistan, flood-hit areas, the challenges multiply. No privacy, little water for cleaning, and unsafe sanitary practices. The results are urinary and reproductive tract infections, skin irritation, and even serious conditions like bacterial vaginosis. And this isn't just Pakistan's story. Globally, more than 500 million women and girls lack access to menstrual supplies and safe facilities. This number is set to rise as climate disasters intensify. In Bangladesh, women during flash floods were forced to use leaves or reuse the same cloth for days, battling stigma and disease. In Malawi, where floods displaced over 800,000 people, women faced not only illness but heightened risk of sexual violence and HIV in overcrowded shelters. The economic toll is just as stark. The FAO reports women-led households lose more income in disasters, 8% more during heat waves, 3% more during floods, amounting to $16 billion in annual losses from floods alone. With us, we have Bushra Mahnoor, founder and executive of Mahwari Justice, an organization working to ensure safe menstrual health management during disaster emergencies in Pakistan. Hello, Bushra. Thank you so much for joining us. To start off, I would like to know your perspective on Pakistan's current policies on menstrual health, especially in disaster-prone areas like Gilgit-Baltistan and KPK.
Thank you so much for having me. It's just such a state of despair that we do not have any one comprehensive policy that is on menstruation, because this is something that continues to be neglected, to be ignored by the state. Since menstruation is treated like a stigma in our society and we do not talk about it, and when we do not talk about something, how are we going to understand the problems, the issues concerning the same matter? And everybody just continues to ignore it. It has been the same. We started Mahwari Justice in 2022 when the floods affected one third of our country, and there was the same need that menstrual health needs of the flood affected people were being ignored, and they were being ignored by the state, they were being ignored by the relief organizations, and there was no comprehensive, not even one comprehensive paper or a guideline or just a pamphlet that ensures what do you have to do when a disaster hits, how can relief organizations coordinate their efforts, or how can they help when a disaster strikes. So, and it has been 3 years. We have been working, we have been pushing for this, we have been pushing for inclusion of menstrual health management in the curriculum, in workplaces, and it's the same. And it just makes me so sad that 3 years later, we are in the same situation. Disasters have struck again, and the needs of menstruators are again being ignored, and we are at the same state again.
I think you're absolutely right that this topic is not addressed openly, especially in countries like Pakistan. And when it's not addressed openly in countries like ours, it does not make it to important board meetings and important policy discussions, which is why it is so important to, raise awareness about this specific topic. So my second question to you would be that what policy reforms do you think are important to make sure that menstrual equity is actually a part of next year's disaster response planning?
First of all, it's very important to focus on proactive measures. You cannot just take action after the disaster has struck. The government needs to work with the people who are living in disaster prone areas. Pakistan is being hit by climate change in the worst possible ways. And even if we don't want to believe it, we are going to have even worse floods like this one, even worse than 2022 again and again, and their frequency and their intensity is going to increase. So, just giving out period supplies after a disaster has struck is not the solution. You need to work with the people. You need to provide them information on what to do before a disaster strikes, what to pack in an emergency period relief kit when you're leaving the home. How can you ensure that there are safe bathrooms available for women, for menstruators, to change the period supplies, because privacy is such a big concern for people. And how do you ensure that people have access to safe supplies when access to safe water runs out? So these are some of the things that the state has to keep in mind and work with the people. At the same time, we have to build an infrastructure of public bathrooms, as many bathrooms as possible, because when men can go to any toilets anywhere, women cannot. And then there is an issue of privacy. And when women are alone, wanting to use the toilet, their issues of sexual harassment, they just skyrocket, because they are putting themselves in an extremely vulnerable situation. So action before a disaster strikes, working with people before the disaster strikes, is the key to making sure that people do not lose access to their safe period, because right to safe period has to be considered a fundamental human right. Why should it be ignored? Why should it be snatched away from somebody, no matter what the situation is or whenever a disaster strikes?
I think what you said actually sums it up, that it's as important as food, as shelter, as medical supply. It's just that we don't talk about it enough. And the other thing that you mentioned, that we have to adapt, we have to act before the disaster strikes. If there is something that we actually learned this year, it is that climate change won't stop. These disasters won't stop. So we have to adapt. We have to come up with policies that can actually be coherent with when the disaster strikes. So my next question to you is that, in your view, how have the floods and other climate-related disasters complicated menstrual health, especially among women and girls in flood-affected areas?
Again, it's a very depressing situation if we look at it, because Pakistan does not, in Pakistan, people do not have access to safe periods, majority of the people, because again, periods continue to remain a very tabooed subject. Even without disasters, using extremely sometimes unhygienic measures to manage their periods. And sometimes when we work with people, they just tell us that the concept of having a proper menstrual management is not even there. And in some places, people would just dig out a hole and then sit on it for a few hours when they're bleeding, because the idea of using something, even a cloth or anything, is just so alien. And it's just so sad as well that if we are living in 2025, people are going to space. We are very close to having like flying cars, and people have to sit on a hole that they dig in mud to menstruate, because they do not have any other option available. So many children have to leave their schools as soon as they start menstruating, because this is seen as a sign of puberty, and our government hasn't taken any comprehensive action on it to mitigate that. And still, we see so many people that we work with, those little girls are just taken out of the school the moment they start menstruating. So this is the situation that we have at hand right now. On top of it, when a disaster strikes, the supply chain is just shattered. People do not have access to any clean water, any safe period supply, even a clean cloth. In 2022, when we started working, people told us that they were tearing off their dupattas and they were making like cloth pads. People have to share a piece of cloth because there is no other option available. And it is the same situation right now. And people, and again, what really complicates this problem is that the relief efforts are being carried out by men. People are not comfortable talking about it very openly. Not, I mean, people cannot even talk about it openly in their home. So how can we expect them to tell their needs to relief workers, who is a man of all people? So it just complicates the entire situation. We are also expecting how many child brides are going to increase. The number of child brides are going to increase during the disasters, because people, it's just easy. If your daughter starts menstruating, she is ready for marriage, because it has extremely lucid, extremely loose laws, and you can just sell her off, receive some money, and keep going on with your daily affairs, and also there's just one less mouth to provide food to. Menstruation is not just an issue about health, it's related to girls' education, their marriage, their life, their career, their mobility. And it's very disheartening to say that we do not have any plan to mitigate that. We do not still have any, the government is still not taking any action. It's not on anybody's priority list, and it just uh, cannot sit well with me that why are people not speaking more about it.
I think what you said is extremely important for all of us to understand that climate change is something that impacts women more. And it's high time that we start acknowledging this fact, and it's high time we actually start including more women in policy making when it comes to climate change, and more women when they're making these disaster risk programs, because there is a element of shyness, especially in our society, because these topics are not spoken about so openly. So this is something that the government should actually immediately consider also, to include more women, make units that consider of women. So my next question to you is that, do you think climate change is likely to make period poverty worse? And do you think that it's going to be a long-term problem in Pakistan? And if so, what immediate measures do you think we can take?
Yes, it's definitely going to make period poverty worse in Pakistan, because climate change means no more access to safe water. If you're menstruating, you have to use the toilet, you have to clean yourself. How do you do that? And if you cannot do that, and if you are afraid that the menstrual blood might leak through your pants or your clothes, how are you going to go to school? How are you going to go to work? How are you going to make even fetch food and water for your kids and family? So it definitely has devastating impacts just beyond the health mechanism of menstruation. The main problem that we face right now is the fact that, again, it's on nobody's agenda, which is really, really sad. And in order to combat that, in order to make sure that not millions of Pakistanis are thrown into period poverty because of this. And again, like I mentioned, period poverty is related to child marriage. Period poverty is related to dropout, increasing dropout rates of girls from school, is also related to women not being able to go outside of the house, not being able to work as they wish. So, high rates of period poverty is extremely dangerous for the current situation of gender rights in Pakistan. And in order to combat that, we need to work on having proper infrastructure, having MHM included in the curriculum, because we have to teach our kids, not just the girls, we need to teach our boys too what is menstruation. It is a simple biological process. We have to start having open conversations about periods. You need to include young people, you need to include young menstruators in these conversations to find a way forward. So having MHM, comprehensive MHM in school curriculum from class 5th and onwards is a necessity, and we really need to focus on that.
I agree with you, especially with the shame part. A lot of shame is actually stigmatized around it. And even educated people, people in cities like Lahore, Islamabad, Karachi, we are also often found, not talking about it enough or hiding. The example that you gave about Ramzan, it's very common in so many households. And I think the first step is indeed awareness. And especially with today's day and age, today's social media, it's not that hard. If there's a will, there's a way, and we need to give this information. We need to give this information. We need to spread this message across as many households as possible. And educating boys and men is actually the first step as well. We also spoke about relief programs, and we spoke about that, relief programs often focus on water, food, shelter, and medical supplies. And they should focus on menstrual hygiene and menstrual products as well, because they're just as important as these other necessities. So, do you think that the current relief and emergency programs that are being offered in the disaster-prone areas, are they focused around menstrual hygiene and health?
Actually, I was very surprised to say this time when we started our camping in 2022, we were met with a lot of backlash. Most of our time we had to, spend explaining to people that menstrual health, menstrual needs are important, and you need to pay attention to that as well, because this was something that wouldn't just sit well with the people, and we would have to explain it over and over and again that why you should donate to it, why you should come to our packaging kits, why you should volunteer with us. And while doing so, we also realized that we were able to mobilize a huge population of young people. And that is how in the past 3 years those conversations about periods and menstrual health, they have been coming up again and again. And this time we were very well prepared when we started our campaign. I mean, again, it was a very devastating situation. There are floods in our country. There was something on the back of our heads that, we will be met with that sort of backlash and hate speech. And But it wasn't it, and that really surprised me, that the efforts that we and many other organizations also led in 2022 by starting a countrywide campaign, and continuously speaking about period rights and period poverty in times of disaster. It has had some impact. And right now, a lot of people, a lot of organizations even who wouldn't work with us, saying that, you're working on women's issue and this is something we don't consider worthy of working with. They reach out to us and they ask, we are providing relief on our own, can you please guide us on what to add in period relief kits? And that is something that was really shocking to me. And it also made me really, really happy as well, that there is this change in the society and people are actually talking about menstrual health and menstrual relief when they're making relief kits for the flood affectees. At the same time, we also have to understand that a handful of organizations working on this is not enough. This is our state's responsibility. It's not the responsibility of just the citizens aligning, joining, and making alliances and working to send period relief to the flood affectees. It is the state's job at the end of the day. This is what they're there for. So yes, while I do see a lot of people coming together, while I do see a lot of positive response, a lot of people willing to donate, a lot of people willing to volunteer, they're coming, they're coming with their sons, they're coming with their daughters, people are coming with their fathers to whenever we package the period relief kits, because we pack them in Islamabad, in Lahore, in other places, and then we send them to the flood affected areas with the doctors who are arranging medical camps, or the local organizations, female led organizations present in the flood affected areas. So, and we have seen a lot of people join us this time, and people join us without questioning us. So they're understanding it, and these past 3 years of work has been fruitful, I have to say. But at the same time, it's not enough.
That was Bushra highlighting how climate change is inflicting deep trauma on women in vulnerable communities. To take this further, we're now joined by Ayesha Amin, founder of Baithak, a feminist, women-led grassroots organization working at the intersection of gender, climate, and sexual and reproductive health and rights. Hello, Aisha. Thank you so much for joining us. So my first question to you is that after the recent floods, what immediate menstrual needs did you observe among women and girls in KP and Gilgit-Baltistan?
Thank you so much, Mahin, for having me. And I think it's a very, very important question, because usually when we talk about floods or a disaster, menstrual needs or menstruation is not even like the immediate thought, but we don't really think about it in the relief work. So, given in the light of the recent floods that we see in northern Pakistan, what we're hearing, what we've been receiving is that a lot of women and girls, because they have been either displaced or affected, have lost access, whatever access they had, to menstrual products. So for example, those who have been displaced, of course, their access to, let's say, markets have been cut down, right? So they cannot, even if they were using disposable pads, they're unable to purchase them. But also, like, women who were using cloth, for example, right? They don't have the wash facilities or privacy, or safety to continue using those, because the places, the shelters, or even like the temporary shelters are overcrowded. There's no privacy. So we are getting a lot of support calls from the communities that we worked with in past for urgent need for menstrual products.
The situation does seem extremely bleak, when you talk about menstrual health, especially in disaster-prone areas. Now, I also know that a lot of sanitary kits are being distributed, so I would like you to expand a little bit about what exactly does a sanitary kit include, and how do you make sure that it's well suited for women and girls in these disaster-prone areas who are living in emergency camps?
So like a sanitary, I'd like to call it a menstrual kit. can include, I mean, again, it can vary, but the ones that we are making have the immediate supplies that are needed for managing menstruation. So each kit will serve one period cycle. So it has two packets of disposable pads, a pair of underwear, plus a soap and a detergent, like a small sachet of detergent.
So, what challenges do you face while you're distributing these kits? For example, logistical challenges, stigma, and funding opportunities as well. Can you also expand a little bit on this?
Okay, so multiple challenges. First, of course, menstruation is a very taboo topic. Even let's say in circumstances or contexts outside of a disaster, like generally in our culture, we don't really discuss a lot about menstruation. It's something that you're supposed to treat with silence, or there's a lot of shame. In a disaster setting, the stigma is even worse because even I think women are conditioned to not to prioritize their own needs. And then when these needs come with cultural stigma, there is more guilt and shame, right? So we hear from a lot of women who so desperately, need safe menstrual products. But there is a sense of guilt when they even ask for these, because they'll be like, okay, this is a disaster setting. Maybe we should prioritize something for our children, or medication or clothes for our children, right? So this idea of prioritization of what need is important and what is not. So there's definitely a lot of stigma, which does create challenge in terms of delivering those kits. Then financial, of course. Generally, people are more willing to, let's say, donate for other items like food, clothing, shelter, which again are important needs. I'm not saying that these are not important needs, but at the same time, menstrual products are also an essential need. So we have to um, we have to put in a lot of effort in first creating, like, communicating why are we fundraising for menstrual products, like why is it an essential need. So one level of challenge is that we have to sort of really make people understand it. Okay, this is an important need, this is non-negotiable. So funding, of course, is a challenge. And now with the floods in northern Pakistan, logistics is also a bit of challenge, because roads have been washed away. So we are sending the kids from Islamabad, and so it is taking longer for the kids to reach there. It is even taking up to 3 to 4 days for everything to reach there. So there are logistical challenges as well, because of loss of infrastructure.
As you mentioned, there is indeed a lot of guilt and shame, attached to menstrual health. And this is something that we really now have to overcome because climate change is impacting Pakistan and it's not going to stop. It's only going to get worse with time. And menstrual health is something that should be talked more about. And it's time that we start focusing on this and we stop treating it like a stigma. So, my next question to you is that what policies and reforms do you think should take place in order to overcome these barriers that you just mentioned?
Really good question, and I think we can do a lot. So first, it is very, very important for the government to have menstrual policies in place, even for context outside disaster. Because again, the stigma is something that the government. So, for example, let's say it is very important to integrate this into curriculums, right? Like students need to learn this. We need to normalize this more. We need to have policies in workspaces, so we sort of destigmatize menstruation. So even in a disaster setting, it is seen as a natural need, like that is non-negotiable, like, because again, when we talk about frameworks and policy, not only at the country level, like in globally, even if we see how menstrual health or reproductive health, where does that stand when it comes to crisis response. Even the gender action plan within the UNFCCC's frameworks, we see that sexual and reproductive health is not prioritized there. And because this year, the Gender Action Plan is expected to be adopted, the Enhanced Gender Action Plan. there has been a lot of advocacy from feminist activists for integration of sexual and reproductive health and rights into that. So I think, given that, and I think it's even more urgent for Pakistan, because we, as you mentioned, we're a very climate vulnerable country. We anyways do not do very well when it comes to a lot of parameters on gender equity, and with every climate disaster, we are only making groups of young girls, women, grassroots communities, persons with disabilities, we're making them more vulnerable. So for us, it's even more important to look at these intersectionalities of gender, and with together with other intersectionalities when it comes to disaster response.
I think you're absolutely right. It's extremely pertinent now more than ever to acknowledge that women get impacted by climate change more. And I think it's time that we start creating separate units for climate change and we start pushing more women towards policy making when it comes to climate change and when it comes to menstrual health. So, my question to you is that do you see climate change making menstrual health a recurring crisis in Pakistan? And what long term policies would you suggest to combat this?
Yes, absolutely. With again, if you don't prioritize menstrual health, if girls and women do not have access to, let's say, safe and clean wash facilities or menstrual products, it's going to get worsened. And when we talk about access to, let's say, menstrual resources, it does not only include per se pads, right? It also includes access to wash facilities, just say gender segregated toilets, clean water, etc. And in absence of these, we're putting girls and women at serious health risks. So yes, the more climate crisis we see, it is going to, in absence of this infrastructure, or in absence of these policy frameworks, the menstrual health will continue to deteriorate. And in terms of long-term policy frameworks, I think it is absolutely important that at every level of our disaster planning, again, and I focus a lot on the planning that goes at very local level, district level, provincial level, right? It is so important that gender is integrated into every component, right? Generally what we do, how our take on gender is that it's an afterthought. You make a policy, and then maybe the government, maybe for tokenism, will do a consultation after making a policy, or will do a conference and say we're doing a conference on climate and gender, etc., right? Gender needs to be the lens with which we draft policies, with which we plan and think. And in order to bring that element, it's very important that we have young girls, we have women, and we have girls and women of all identities.
You just mentioned that gender needs to be the lens with which policies should be drafted. So, my next question to you would be that, in your experience, are menstrual needs a part of national and provincial emergency programs?
No, they're not part of it, unfortunately. I would say that especially from the last floods, from the 2022, and I have to give a lot of credit to civil society, especially, women-led organizations and feminist activists who have been working. I think now we see that at least in the response by civil society, the response that we have from grassroots organizations, there are more discussions and more openness on providing menstrual and dignity kits. And again, I don't think that it is again part of any government policy or any initiative from the government. At least I am not aware of any such initiative by the government that prioritizes menstrual needs. But if we see, like, in these 3 years, because of the advocacy that women-led organizations have done, that the activists have done, we see that there's more openness in sort of asking, okay, the girls and women in the affected regions, if they need the dignity kits, and so we see that there has been a slight change, but I think that is only because of the advocacy that women-led organizations have done.
Well, I hope a change comes by and I hope everyone starts playing their part. Okay, so my last question to you would be that what role do you think government, NGOs, and the private sector can play in creating resilient menstrual health solutions for communities that are affected by climate?
I think these are very, very important stakeholders, and each one can play a very different role. So, for example, the private sector, whether it's the, let's say, if it's the organizations that maybe have innovation or technology to make solutions around menstrual health, let's say, or even funding. I think a lot of that support can come because even when we see innovation around menstrual health, we don't see, I mean, I can't pick and say, okay, this product is completely safe and healthy for managing menstruation, right? So the private sector can definitely play a lot of, like a very big role in terms of providing that innovation, taking a lead, maybe constantly thinking, how can we make menstrual products more accessible during emergencies? How can wash facilities be safer? How can they be, maybe more resilient when a disaster hits. So I think the private sector can play that role very well, which I feel that maybe right now it's not playing. Like, I think there are a lot of gaps. The government, of course, now again, if you talk about grassroots organizations, if you talk about non-for-profit organizations, the scope of the work will always be limited as compared to the government. The government scale is huge. Anything that happens at the government level, right, will have, far more impact. I remember in 2022 floods, I think it was Minister of Human Rights, I might be blinking, but she was the one who said it on media and said that, women really need menstrual products. And just her saying this did sort of, create a very huge impact because people started thinking, because of course she was a representative of the government, and her saying that, women really need pads is also, it also sort of started changing people's perception around, okay, what is needed during disasters. So the kind of reach, the kind of resources the government has, that is far, and but I think the impact can be really great. So the government can play its role in terms of scope, in terms of policies, in even in terms of coordinating the response. I feel like the response, even in the humanitarian sector, when it comes to grassroots and non-for-profit organizations, is not very coordinated right now. And that has been the weakest link that we have, whether it comes to provision of menstrual kits or general, in like the response in general. So I think the government can really leverage data and the reach and the skill of its operations to coordinate the response. And again, the NGO or the development sector or non-for-profit grassroots organizations, they have been playing a huge role. Like whenever a disaster hits, they are the first amongst the first responders, so they know what are the lived realities, like what are the real time needs. So a lot of insights can come from those grassroots organizations. So I think if each of this stakeholder can play its role in a way that's also coordinated, I think we can have a much better response mechanism and a much better way in how we meet menstrual and reproductive health needs of young girls and women.
I think you're absolutely right. Everyone has their part to play when it comes to the government, civil society, private sector, NGOs, everyone. And I hope that menstrual health gets the same importance as any basic need and as any basic right. And I really hope that the awareness continues to grow. Thank you so much for your time, Aisha. What our guests have made clear today is this: menstrual health is not a luxury, it is a human right. And in disasters, it is one of the first rights to be stripped away unless we act. To build resilient responses, we must integrate menstrual health into minimum initial service packages from the very beginning of the disasters. Distribute dignity kits proactively led by women for women. Ensure safe private wash facilities in camps and displacement sites. Break the stigma through local education and open community dialogue. From Pakistan to Bangladesh to Malawi and beyond, the menstrual crisis in disaster zones is global. But so too is our capacity for empathy, for innovation, and for change. That's all for this episode of Front Seat to Climate Change. I'm Mahin Azam Khan. See you next week.